Mask messaging has been contentious. Part of the controversy early pandemic regarding face masks was that there was limited supply for healthcare workers in direct contact with COVID-19 infected patients. Times have changed with the variants, and N95 face masks are now widely available to the consumer. We still know too little about this threat. We know that it has been enabled by giving it room to grow through inconsistent prevention strategies and individual behaviors. Those with immune-compromised systems, comorbidities, and a multiple of other factors potentially present in both vaccinated and unvaccinated populations, creating a threat spectrum that requires universal and effective personal protective equipment and adequate social distancing and knowledge of multiple disease transmission pathways. We were worried from the beginning, January 2021, that SARS-CoV-2, a respiratory virus that seemed to behave like a hybrid of classic pathogens, microbes that cause disease, could potentially be transmitted by aerosol, further casting doubt on the safety of cloth masks and other low-performing personal protective equipment. Simply stated, an aerosol is a much finer particle, a smaller particle, than other larger particles such as droplets that we normally associate with infectious disease such as influenza. This diagram well explains the difference between droplets and aerosols. As you can see, droplets disperse less than 2 to 3 meters from their source, meaning a human being. Aerosol, on the other hand, will quickly contaminate an entire room. This is a picture of one of my N95 masks. The N stands for non or not oil resistant, and the 95 reflects its ability to deflect 95% of airborne contaminants. However, that is where it gets complicated and beyond the scope of this short paper. There is no doubt that the N95 respirator efficiently far exceeds both cloth and clinical mask efficiencies. Cloth masks simply do not work in comparison to the N95 against aerosol. However, the N95 will not work to 95% efficiency unless the wearer is clean-shaven or without facial hair, regardless of gender. Hazmat and other first responders will not even admit trainees into official fit test processes. The tightness of the mask is tested against certain oil and smoke if they are not clean-shaven. Therefore, wearing any sort of mask over a beard is not protective against aerosol. What about surgical masks? Common in Japan, the host country of the Tokyo Olympics 2020, postponed to 2021, and happening currently as of this correspondence, your close observation of Olympics coverage will reveal that the surgical masks simply do not fit tight. Large gaps are easily visible in many of the local citizens and even elected officials and some athletes. Our Figure 1 diagram, designed in March 2021, early in the pandemic, still holds. It seems that with each passing month, a new element of the transmission diagram was pushed closer to a point of validation. Of course, the Delta variant is the main game changer, and suddenly not only does our Figure 1 become more significant due to the amplification of the severity of the threat posed by formerly considered low probability transmission pathways, but we also saw a room for improvement for clarification of the human's role in the infection web. Research shows that aerosol transmission is hard to control in the built environment. Researchers have designed models representing the aerosol movement between people in gymnasiums, restaurants, churches, and even among choir members. Many experts are quoting new research literature showing 1,000 times the viral load compared to the initial SARS-CoV-2 virus. Additionally, vaccine breakthrough has been observed in the vaccinated. CDC released new research showing the data behind the transmission of disease to the unvaccinated from the vaccinated. This interesting diagram shows the probable airborne transmission of SARS-CoV-2 in a poorly ventilated restaurant. No close contact or fomite contact was identified, aside from back-to-back sitting in some cases. In our original Figure 1, all potential pathways, even the lower probability scenarios, such as fomite and contaminated environmental surfaces and sewage, should be taken seriously. We added clarification in our updated model to emphasize that humans are not dead-end hosts, simply receiving infection. Rather, they are actively involved in the distribution of infection throughout the transmission web. We present 4 distinct reasons for the update. Therefore, we thought it was important to utilize this information to update our Figure 1 infectious disease transmission model. Crisis standards of care guidelines support healthcare rationing systems based upon patient triage, which is the process that may result in a limitation of services. When scientific and medical evidence is under development, the patient triage process should be carefully intertwined with justice, ethics, and human rights. Even with the best possible plan, it is inevitable that certain groups of patients in exclusion categories will experience negative consequences. To avoid such a tragedy, a public health approach should be adopted when implementing relevant public policies to identify, contain, and mitigate hazards, e.g. virus, as a part of prevention and mitigation strategies. The CDC has projected dramatic increases in future COVID-19 hospitalizations. The forecasts make different assumptions about social distancing measures and use different methods and data sets to estimate the number of new admissions. CDC information provided by the Washington Post shows that the Delta variant is more transmissible than MERS and SARS, Ebola, the common cold, seasonal influenza, and even smallpox. Of course, our global health report was actually initiated to follow the impact of pandemic COVID-19 on the 2020, actually 2021, Tokyo Olympics. Cases were rising then to about 1,300 new cases per day. However, there has been a consistent and dramatic increase of new daily cases in Tokyo, including 5,000 new cases in a single day on July 29, 2021. Japan COVID cases hit 1 million as infections spread beyond Tokyo, according to Reuters. This has been an All One Health Systems LLC and Institute of Wellness LLC production. Please subscribe to our channel.